Welcome to another Tuesday Tips. My name is Pam Dunwald, and I'm one of your nurse advocates with Your Nurse Advocates Consulting. Today, we wanted to talk a little bit about Medicare open enrollment. I know, I'm tired of all the commercials already too. Open enrollment just started October 15th, so all the Medicare commercials are out. I'm getting all the kind of junk mail that in my mailbox every day about Medicare. I turned 65 this year in November, so I have had to apply, and I've done all that. I've chosen my plan, and that's the thing. What I choose for myself may not be the right plan for you. And so we are going to talk a little bit about what you can expect tomorrow night at 7:30 Central Time, 5:30 Pacific, 6:30 Mountain, 8:30 Eastern Time. We are doing an open Q&A session. We are inviting anyone that would like to know more about Medicare, what this open enrollment means. How do you know you have the right plan? What are my options? What kind of things should I think about when choosing a plan? That's what we're going to be talking about. So we're going to get all your questions answered. It's free. I'm going to put the link in there to register. You're going to get a guide and also a checklist. You're going to get PDF, a guide, and that checklist is going to be in that guide. You can take notes. You'll be able to write down things that, as we're talking about options, you'll be able to write down some thoughts that you will have as far as your own personal situation. You know what? We're nurses. We're not insurance salespeople. We are not Medicare advisors, but we don't care what plan you choose. We could care less. That's not our job. Our job is to make sure that the plan you choose is the right plan for you. We want to make sure that we're going to talk about six or seven different things that you need to consider. So we're going to walk through those with you. And our goal is to make sure that you now know what you didn't know before the question and answer session, because that's one of the big issues, is that you don't know what you don't know. So if someone's not telling you all the things that you need to consider, you may not know what you need to consider. So you may not have the best plan that's for you. And so Medicare gives you this grace period every year around the same time, October 15th to December 7th. No matter if you have had a life-changing event or not, Medicare gives you a pass that you can change whatever plan that you have and go to something different. So that's what this period is all about. But why there's so much on the TV in that is because all these insurance companies are promoting their Medicare Advantage plans or their supplement plans. So this is a big time where they make their big push. So I apologize for being, getting in that mix of talking and promoting all this Medicare. But again, our goal is to make sure that you are informed, that you have all the education, all the resources that you need, that when you meet with your insurance agent or you meet with your Medicare advisor, you know exactly what you need for your lifestyle, and they can fit you with the best plan in your area. Because a lot of the plans are dependent on your zip code. Some plans are accepted at certain clinics, some are not. We're going to talk about a lot of those things tomorrow night. So what are the things that we need to consider that we are going to touch base on? So we are going to talk about lifestyle. Lifestyle is huge when it comes to choosing the right plan, what your health status is. We're going to talk about budget. The budget is wide open, all the way from $0 to, a few $100s a month, everything in between. So we want to talk about that, so you know what your options there are, based on your budget. You know what your budget is, you know what you can afford, and trying to get, that best coverage. The third thing we're going to talk about is your choice of doctors. Some Advantage plans, some you have to be in network. So obviously you're going to want to pick a plan that has your doctor in it. Otherwise, you may, if you like other options of a plan, depending on your lifestyle and all these other things, you may have to change doctors. So we're going to talk about that. Traveling. A lot of people don't understand how traveling impacts your Medicare coverage, especially if you're a snowbird. So we're going to go into that in great depth and get your questions answered about that, because there are a lot of special circumstances based on you may be living in two places. So we're going to talk about medications. Do you need a plan with medications, or, how is that going to work? Do you take medications? What kind of a medication plan do you think that you might need? So we're going to touch base on that. And then, of course, we're going to cover the main ones. We're going to talk about what is traditional Medicare and what that's all about. I mean, when the government created that, it was not meant to be, this big, robust insurance plan. It was meant to be like a major medical plan. So we're going to talk about traditional Medicare. We're going to talk about why and when you might consider a Medicare supplement. And we're going to talk about the Medicare Advantage plans. And this is where your Part B dollars, your Medicare dollars, and that go to the insurance company to help pay for your insurance with them. They manage the dollars, and how well they manage the Medicare money is how they make their money. So we're going to talk a little bit about that, but and why an Advantage plan might be a good option. Again, there is no wrong or right reason, only the plan and the choices and the options that best suit you and your family and your lifestyle and your health. So, like I said, we are not promoting one plan or another. We don't care what plan you choose or which option you choose. We are just concerned with providing you with the information that you can use to be able to make the best choice for yourself. So just want, again, tomorrow night, it's going to be, give or take an hour. We're going to do a webinar. We will record it. So I want to make sure I mention that if you do register or you've got something going on tomorrow night at that time, but you'd really like to listen in, go ahead and register. If you register, you'll get the guide, you'll get the checklist, and anybody that pre-registers for our Q&A session, we're going to send you the replay. So you're going to have that video, access to that video, and you'll be able to watch that on your leisure. All we're asking is that you pre-register so that we can get you all the things that go with that and the video. So I'm looking forward to seeing everyone tomorrow evening. We're all ready. Linda and I are all ready to go. You're gonna see Linda. Linda's gonna be participating and sharing some information. So you're gonna hear from both your nurse advocates, and we look forward to seeing you again. Bring your questions. We want to make sure that nobody leaves tomorrow night without getting your questions answered. So we will see you then. Take care, and we will put the registration information in the link here on the Facebook as we're live in both. Tonight we are live both in our Facebook page, the Your Nurse Advocate Facebook page, as well as our community. We have a private community, our forum for speaking out on the care of aging parents, where we talk everything senior care. So we encourage everybody to hop on over there, and we have a lot of things going on there. We will see you hopefully then tomorrow evening. Take care. And again, don't forget, get registered. If you can't make it, you're still going to be able to get all the materials as well as the guidebook and the recording of the video. So we see you then. Take care. Good night.